Next is resuscitation, and we are masters of resuscitation. So severe left V dysfunction, there is cardiomyopathy, hypertrophic, restrictive and dilated. Hypertrophic मतलब हार्ट मोटा हो गया, रिस्ट्रिक्टिव मतलब हार्ट के कपड़े टाइट हो गए, और डायलेट मतलब हार्ट अब कॉन्ट्रैक्ट नहीं कर पा. So coronary atherosclerosis is present in 80% of people who have undergone autopsy after a sudden cardiac death. So sometimes the atherosclerosis will present with a pulseless VTVF and the patient will die and you won't even know about it. The hypertrophic obstructive cardiomyopathy is the most common cardiovascular cause of sudden cardiac death in young people, accounting for 1/3 of such events. Sudden cardiac death, sudden VF in a patient completely fine, completely healthy, athlete, practicing, and the person dies. There is a systolic murmur, ejection systolic murmur, and parasternal heave, of course, sometimes. And the risk runs in families. HOCM runs in families. Every year you pass, your risk of dying increases by 1% with HOCM. Treatment is an implantable cardioverter defibrillator. An LV wall thickness more than 30 mm or a history of syncope is also an indication of ICD. So किस में लगाना है? Prior cardiac arrest, prior VF, hemodynamically sustained or significant or non-sustained VT, a first degree relative who has had sudden cardiac death, example death in father, one or more recent unexplained episode of syncope, and a wall thickness, LV wall thickness more than 30 mm, and an abnormal BP. Next cause is arrhythmogenic right ventricular cardiomyopathy. It is characterized by right-sided heart failure with ECG showing VT with LVVB morphology, mainly T inversion in V2 to V3 leads, V1 to V3 leads, which are right precordial leads. The most common coronary artery anomaly associated with sudden cardiac death is anomalous origin of the left coronary artery from the pulmonary artery. So the left coronary artery is arising from the pulmonary artery. What can cause sudden cardiac death? So coronary artery disease, LV dysfunction, cardiomyopathy like hypertrophic and arrhythmogenic, congenital heart disease, valvular and pacemaker issues, Brugada, early repolarization, which is your WPW, long QT, short QT, catecholaminergic polymorphic VT, and there are some risk factor: hypertension, hyperlipidemia, smoking, diabetes, you're poor, unstable plaque, psychological and physical stress. The greatest risk of sudden cardiac death in children and adults with congenital heart disease exists in those with left heart obstructive lesion. लेफ्ट हार्ट को ऑब्स्ट्रक्ट जो भी चीज़ कर रही है वो मार देगी आपको बचपन में ही. एओर्टिक स्टेनोसिस, एओर्टिक कोआक्टेशन, एब्स्टीन्स अनोमली, ट्रांसपोजिशन ऑफ गेट आइडिया, ग्रेट वेसल्स TGA, especially HOCM obstructs the outflow, you will die. Hemodynamically severe aortic stenosis can cause effort, exercise-induced dyspnea, myocardial ischemia and ventricular arrhythmias, syncope, death. A harsh late peaking systolic murmur. A harsh late peaking systolic murmur at the upper right sternal border with radiation to neck is a typical finding in the aortic stenosis. When there is cardiac pacemaker dysfunction called Lenegre disease, Lenegre, गिर गए, लेने बड़े बूढ़े गिर गए, LENEGRE disease. There is sclerosis, fibrosis, degeneration of the AV node and basal branch. It is Lenegre. and fibrosis of cardiac structure, Lev's disease. Sick sinus is your sinus node stops basically, so you are syncope.